Hello and welcome to my YouTube channel Bsc Nursing classes. So today is the topic that is general principles of mental health nursing. So without wasting the time, directly we will go to the topic. So next principle is nursing care is centered on the patient as a person and not on the control of symptoms. We have to center to the patient, means patient's requirement. Center the patient as a person and not on the control of symptoms. So very easily I can able to make you understand that by giving you example. So in medical surgical, if you are having two patients, both are having pneumonia. Both are having pneumonia and their symptoms fever. So their common symptoms is fever. So you have to focus to the fever, that how it will be controlled and how we can able to decrease the fever. So in this is what medical surgical. But in case of psychiatric nursing, in case of psychiatric ward, what happen if your patient, if the two patient you are having and both are having depression, both patients are having what? Depression. But their cause may differ. Their cause may differ. So how it is? Like why they depress? Why they depress? Why depression occur? So like if both are depressive person and their reasons are different, they are having different reason. They are having what? Different type of reasons. So here one is having, suppose one is having love failure. Nowadays it's very common. Love failure case. And other one is what? Maybe he lost somebody. Lost somebody. Some very precious person. So their reason of depression is different. Means another one is having love failure and another one is having loss of somebody. Means maybe he lost his wife, or wife may lost husband. Maybe whoever he may be, the very precious person, he might. Yes. One is having love failure and another one is having, the cause is what? That is losing someone, losing a very important person in his life. He may be like wife, children's mother, father, whoever he may be. If he has lost somebody and for that reason he is missing that person in his life, and that's why he become depressed. So here our preference should be like what? We have to provide care according to the requirement. They're needy. Not by the symptoms, but by their needy, what is their requirement. Accordingly, we have to provide care to the patient. So, this is what centered on the patient as a person, not on the control of symptoms. We should not always focus on the symptoms, but we have to identify what is their real issues of depression. So accordingly, we have to provide care to the patient. So this principle is that centered on the patients as a person, means as a person what he is needy, what is his requirement, and for what reason he is being depressed. So according to the reason, according to the requirement, we have to provide care to the patient. Then next principle is all explanation of the procedure and other routines are given according to the patient's level of understanding. So here what happened, we have to, how in other patient, how we are explaining procedures before doing any type of nursing care. So here also we have to explain the procedure to the patient. We should not think that he is a psychiatric patient, he can't able to understand what I will speak to them, what I will explain to them, they can't understand. We should not think like that. We have to explain the procedure. We have to explain the procedure to the patient and all the routine. All the routines to the patient, that by observing his level of understanding. Observing means what? Level of understanding. So if he is not getting, first time you are saying, first time you are just making him to understand, but then also you have to try for 10 times, for 100 times, how much possible you can able to try to make him understand. So we should not skip. We should not skip to explain the procedure to the patient. So we have to inform him, we have to make him understand according to his level, that when he can understand that by your using your cleverness, your mind, your smartness, and make him to understand that yes, what a procedure is going to done with you, and what routine, maybe from tomorrow the timetable, the routine may change, another nurse may come to visit you, to take care of you. So before itself, if you are taking leave, if your shift has been changed, you are taking leave, yes, so whatever the reason, you have to explain to the patient that from tomorrow I am not coming, other nurse will come and she will take care of you. So, and what your procedure, maybe your medication, maybe there's some change in your medicational procedure. So you have to make him understand, not one time, not two times. If it is possible that you can able to make him understand for 100 times also, but you have to explain the procedure to the patient. So So this is what all the explanation of the procedure and other routines are given according to the patient's level of understanding. You have to observe what is his level, where, how, which type of, in which way I have to explain him that he can able to understand my all the explanation. So you have to, that is up to you, that how you will observe the patient and how your technique and which all therapy you can use to make understand the patient, that is up to you. But before doing any procedure, before changing anything in his daily schedule, you have to explain him before. This is must needed. This is the principle. This is 11th principle of a psychiatric nurse. Now, last one. Many procedures are modified, but basic principle remain unaltered. Means what? Gradually, there are so many development occurring in our medical field. Maybe like your technology may change. We can use different type of instrument, machines for the procedure. Before that was different, and gradually when the technological world is changing, accordingly the medical procedure for medical procedure, maybe the machines, the technology, the therapy, every day daily it is changing, so that may change, but the principles remain unaltered, that never change. What is your principle? You have to give care to the patient, daily checkup, behavior. So in all these things should be remain constant, but the technological equipment, technology of giving like shock, yeah, or whatever it may be, psychological procedure, psychological therapy, that may change because of technological changes, but your principles remain unaltered, that never change. Everything, what as a nurse, what is your duty, what is your responsibility, that never change. So this is the last principle of mental health nursing. So very shortly, again I will revise everything very shortly. Like first one is the first principle of mental health nursing is patient is accepted exactly he is. Yes, this is two type, like being non-judgmental and non-punitive, means you should not be judge the patient for giving any care. We should not judge the patient by his background, his personal things, or we should not punish the patient. We should not punish directly, indirectly. You should not give any type of verbal, inverbal, or we should not give any type of verbal, non-verbal punishment to the patient. We should not give any physical punishment to the patient. And second is what? Sincerely, we have to listen. Sincerely, you should show your sincereness, interest to the patient. Yes, everything we have to listen very clearly from the patient, and then only we can able to give care to the patient. Then third is the recognizing and reflecting on feeling which patient may express. Yes, we have to observe the patient and what he is explaining, what is his feeling. You should recognize that, and accordingly you should give nursing treatment to the patient. Then be talking with purpose. Yes, we should not waste the time while talking to the patient. What is his requirement? Accordingly, we have to talk. We have to give the care to the patient. Unnecessarily, we should not spend our time, because we may having extra more patients for our responsibility. So that's why we should not waste our time for one patient. Then listening, yes, listening is most important. It's very patientful things that we can listen to someone, means a nurse only can do this type of listening patiently, because when we listen patiently to the patient, then only we can give him or give her a quality treatment by what is according to his need or his requirement. Then permitting patient to express strongly, yes, we have to totally give freedom to the patient that he or she should express their feelings, their emotions very freely without having any dread and fear. So this is the permitting patients to express his feelings. Then use, second one is the self-understanding as a therapeutic tool. Yes, means if you are having knowledge as a nurse, as a psychiatric nurse, you are having knowledge, you are having the strength, the capacity, the tolerating power. So these all things is what, that is your therapeutic tools, and accordingly you have to understand the patient, their requirement, and first you have to give respect to yourself, then you can respect to other. So being a respectful person, you should respect to other also. This is what you have to manage the situation, because you are a nurse and you are having the knowledge, the everything, the strength to manage the situation. That is what, that is the therapeutic tool. Then third is consistency is used to contribute to patient's security. Yes, consistency means regularly, and which in regularly, what is your purpose, regularly how you are coming and greeting the patient, and routine, your timetable, everything how it's going in first day, that should be continued. Then only the patient have the patient can believe you and respect you, and acceptance may be more. So your consistency, your continuity, your consistency level should be continuity, that should be continually same. You should not, first day you behave properly and second day you are just avoiding the patient, and your time of coming, going, everything that be irregular. So that should not be happen. You have to be on time to the hospital, and you have to manage all your things in a routine manner. And fourth is what, reassurance should be given in a subtle and acceptable manner. Yes, reassurance means we have to give to the patients what, we have to give patient to a right hope, not wrong or false hope. We have to assure the patient in right way, not wrong way, and what he is saying, that we have to accept in his manner, in good manner. We have to what, we have to give good assurance to the patient. We should not lie to the patient. The last fifth is patient's behavior is changed through emotional experience, not by rational interpretations. Means what, we should not advise to the patient, or we should not interfere in his natural habit, or again we are just asking him, we don't do that, don't sit like this. So this type of things should not be used. We have to emotionally we can change his behavior by showing some drama, yeah, some like role play, yeah, telling some sad story, that emotionally he can able to understand. And sixth is unnecessary increase in patient anxiety should be avoided. We should not increase patient's anxiety level. If something in some word, or some situation that is affecting to him, that should be sensible to him, means we should not create that type of situation. We should not speak that type of words that can affect to the patient, or we should not show our own emotion or anxiety, our own anxiety to the patient. So from these all things, patient may affect and that will lead to his mental disturbance. So for that reason we have to avoid the patient's anxiety as much as possible. Then seventh, objective observation of patient to understand his behavior. Yes, we have to very keenly, very clearly we have to observe the patients without his awareness. Without his awareness, we have to observe the patients. We should not use anything or add anything from ourselves. Only thing is that what is patient's needy, we have to fulfill that. Then maintain realistic NPR. Means what? This is very professional relationship we have to maintain with the patient. We should not show our emotion to the patient, but we have to ask patient's emotion. We have to know patient's emotion, and accordingly his feeling, his emotions and needy, that is only important rather than your emotion. Gradually when you started talking to him, you be very close and you are starting saying about yourself to the patient. That should be prohibited. We should not speak our problem to the patient, but we have to manage patient's problem. And ninth is avoid physical and verbal force as much as possible. Yes, before itself, in first principle itself, I told you that we should not give any punishment to the patient. It may be physical or verbal. Today we studied about the general principles of mental health nursing. So if there is any doubt, any confusion, you can message me, you can comment me in comment sections. एंड जाएगा हिंदी इंग्लिश एक टॉपिक का 2 लैंग्वेज में मैं वीडियो बनाऊंगी ताकि ये आपके लिए ईजियर हो सके. आपको लिखने में कोई स्टूडेंट्स को थोड़ा लिखने में इशू आता है, इंग्लिश में है पर हिंदी में ही समझ रहे हैं, उसको लिखना है, इसलिए आप मेरे दोनों वीडियो को देखें और ताकि आपके लिए ज़्यादा सहूलियत हो. सो थैंक यू सो मच.